So thank you very much for your submission. Thank you for your time. Well done. Okay, we have got Angela. Please. Have I said that right?
Angela.
Oh, who's here? Angela. Thank you.
Okay. Kia ora koutou. Thank you for the opportunity to come and present some of our research findings that support our submission on the long-term plan. My name's Dr. Angela Curl, and this is my colleague, Dr. Helen Fitt. We're lecturers and researchers in the Department of Population Health at the University of Otago in Christchurch, and we're also co-directors of a Transport Society and Environment research group. So we know... Is it going? Left and right. There we go. There are multiple pathways in the relationship between transport and health, and that increased capital spending on walking and cycling infrastructure will therefore have substantial public health benefits, but through both being beneficial to health through those pathways on the left and removing the detrimental aspects of health from those on the right. So jump ahead now. So our research is particularly focused on transport and health, and in particular what we're talking about today is access and the way in which showing that people have access to the things that they need can be beneficial to their health outcomes. And we particularly commend the Council for following best practice in terms of taking a holistic focus to the social, economic, environmental and cultural aspects of transport in the strategic outline around the plan, but think that there could be more done operationally in implementation in terms of where the investment lies. So we know that poor transport options lead to missed appointments. That's one way in which transport affects access and health outcomes. So this is showing data from the New Zealand Health Survey, which shows people who've been unable to get to a GP in the last 12 months because of a lack of transport. And we can see that our transport system is failing those who are already living in the most deprivation. And we know that less than half of Christchurch's population are within walking distance of a GP, and over a third of the population are more than half an hour away from their nearest GP by public transport. So when we think about what that means in terms of people who may not have a car and being able to get to the healthcare, and we know that if people don't make GP appointments, then they're more likely to present at a later stage of diagnosis and have poorer health outcomes. And so I'm going to pass to Helen now to talk a little bit more detail about some work we've been doing with residents of the Otatahi Community Housing Trust.
Yeah, so this is part of an infographic showing some of the results of the work that we've done with social housing residents here in Christchurch about transport and about how they get around. And I think results suggest that our respondents in social housing have fewer ways of getting around and doing things than do most other New Zealanders. So, for example, only 4 out of 10 of this cohort own a car or van, and that compares to 9 out of 10 New Zealanders. And similarly, only 7 out of 10 people in this cohort have a person in their household who has a driver's licence, which compares to 9 out of 10 New Zealanders. We could go on to look at things like access to cycling, and we have similar statistics on those. But I want to make the point that how many ways of transport you have access to can be important, but more important is what those modes of transport allow you to do, what you're able to get to. And 3 out of 4 of the people in this cohort told us that they struggled to afford transport costs from time to time. We also asked people in this particular group whether there was anything that over the last 12 months they hadn't been able to do, at least occasionally, because of transport difficulties or costs. And 7 out of 10 of this group told us that over the last year, at least occasionally, they hadn't visited a doctor or been to a medical appointment because of transport difficulties or costs. 7 out of 10 told us that they hadn't been grocery shopping, and 7 out of 10 told us that they hadn't met a friend or relative because of transport difficulties or costs. Now, obviously, this is pretty bleak from a health and well-being perspective, and I think from an equity perspective, I think it's quite unlikely that many people in this room, certainly not 7 out of 10, didn't go to the doctors last year because of transport difficulties or costs. So with this research in mind, with people who live here in Otatahi, we very much support the focus in the long-term plan's transport provisions for improving equity, including through making sure that there are options available to everybody and through improving public transport services to the most underserved areas. So with that in mind, I'll pass you on back to Angela. For some further
Yeah,
thoughts.
so this is a little summary from some work we did for Waka Kotahi on how to achieve more equitable mode shifts. So we did a review of international evidence, which suggested that the highest priority for achieving mode shift in an equitable way is to shape urban form. So reducing the need for people to travel long distances at all, which will reduce those cost and financial barriers if we don't have to travel as far to reach the things we need to get to, and reducing the need to travel overall, and especially reducing the need to travel by car, which also has all of those broader population benefits that we outlined at the outset. So, thank you.
Thank you.
Absolutely perfect. No, it's already got perfect timing. Thank you. That was, and bringing those numbers to our attention. That's very good. Thank you.
We do have some copies of a more recent infographic if people would like them. Okay. We'll pass these around. We only brought a few, but we have got some more if we need to provide more.
Thank you very much.
Thank you.
Mary, please. And I see